Are you a distance runner dealing with knee pain, specifically in the front part of the knee? Well, in this video, we're going to go over some of the common causes of this knee pain, as well as strategies and exercises to help fix it. Hi, my name is Connor Ganser, and I'm a physical therapist who specializes in treating endurance athletes, including swimmers, cyclists, runners, and triathletes. My goal is to provide you with the tools you need to optimize your training and come back from injury fast and stronger than ever so that you can crush your races. Now, with that said, let's go over some of the causes of your knee pain as a runner and how we can address them so that not only do you get rid of the pain, but prevent it from coming back in the first place. Knee pain is one of the most common injuries that runners suffer from, but what might surprise you is that the problem isn't usually coming from the knee itself. The knee's job while running is pretty simple. At certain points, it's going to bend, it's going to straighten, and it's going to stabilize your leg when it hits the ground. However, weaknesses or deficiencies in other parts of the body or training errors can hinder the knee's ability to do its job effectively and efficiently, leading you to feel the pain that you're experiencing that brought you to this video. The first cause we'll discuss is having too big of a swing in your weekly training mileage. If you're constantly swinging from 10 miles per week to 30 miles per week, you can do all the stretching you want, but your body will continue to accumulate injuries just because it's not able to adapt fast enough. So, how should you structure your training to prevent injury? This is where we can discuss something called the 10% rule. The idea is not to increase your weekly training mileage by more than 10%, or your individual long runs by more than 2 miles per session. So for example, if you're running 20 miles per week, the next week you would not do more than 22 miles in total, and if your long run was 6 miles, you would not do more than 8 miles. The other side of this, aside from doing too much training volume or how many miles you run per week, is doing too many hard runs per week. Research shows for endurance athletes that doing more than 2 sessions per week doesn't really provide much of a performance benefit. So what you want to do is aim for 2 high intensity sessions per week that are shorter, and the rest of your run should be easy runs, where you can speak in full paragraphs and breathe through your nose. If you're not able to do either of those 2 things, then your run isn't easy enough. The next cause of knee pain we'll talk about is a running form mistake that often goes overlooked, and it's having too rigid or stiff of an upper body while running. You want to have some twist and arm swing while you're running so that your body is able to absorb and disperse the load that it gets from your foot hitting the ground. You can take an extreme example of this by looking at a baseball pitcher. It's not all coming from the arm. What they do is they lift their leg to generate power, and then as they step through, they're transferring that force through their leg into their back, into their arm to throw the ball as fast as possible. Obviously, we don't have to twist our bodies as much as a pitcher does, but it's an important thing to consider when you're dealing with knee pain. Now, here are 2 drills that can help you with this if you're struggling with it. The first is dynamic arm swings, where you're emphasizing the motion. And the next is A-skips to help you get the timing down. The next running form mistake we'll go over, which can contribute to knee pain, especially if you're already experiencing it, is leaning too far back while you're running. Research shows that the further you lean back, the more load you're actually placing on your knees. So it's very subtle, but you can try this for yourself and notice a big difference. Try just leaning back while you're running, and then try again while you're leaning more forward and see what feels better on your knees. The next cause we'll go over is hip weakness, which if you're experiencing this, you'll usually find that your running form breaks down later in your run as you're fatigued, making your knee work harder than it should. Here are a few exercises that can help strengthen your hips so that this doesn't happen to you. The first exercise is a standing side kick with a band. You can do this one by holding on to something to stabilize yourself and kicking out to the side and slightly back in a very slow and controlled manner. Do this 3 sets of 15 reps with a 30-second to 1-minute break in between on each leg, and you should feel a deep burn in the side of your butt muscle. If you don't have a resistance band, another option is to put your back against a wall while laying on your side and raise your leg up with a towel against your heel to help you slide. You should feel that same burning and follow the same reps, 3 sets of 15 on each side. The next exercise is standing marches. From here, you're going to hold on to something to stabilize yourself and place the band around the middle of your feet. From there, raise your leg up as high as you can and then slowly lower back down. You should do this 3 sets of 15 to each side. If you feel like you thud your feet while you're running, this will help with that. The next exercise is called Copenhagen's, which works the inner hip muscles. These help to stabilize your knee while running along with the outside hip muscles so that it doesn't have to work quite as hard as we have talked about. In order to do this one, prop yourself up into a side plank position with 1 foot on top of a surface, whether it's a couch or your bed, and the other leg bent. From here, you're going to try to raise your hips off the ground as well as your bottom leg. Repeat 3 sets of 15 on each side. The last hip exercise we'll go over is crossover lunges. This brings everything together and loads your leg up similar to how it would be while running. Now, what you're going to do is take one leg and cross it behind and across your other leg as you lunge forward, putting your knee over your toe with the front leg into a lunge stance. From here, you can just come back up to a standing position. Same thing, 3 sets of 15 on each leg. The last cause we'll go over is a lack of ankle dorsiflexion, or simply put, how much you can point your toes up towards your face. Let's go over a couple tests to see if this is your problem. The first thing you're going to want to do is get a tape measure or ruler and place it up against a wall. From there, put your foot against the wall and try to touch your knee to the wall in a lunge stance. If you can do this, bring your foot back slightly and try to keep touching your knee against the wall, and repeat this until your foot has to come up off the floor so your knee can touch. Once you get to that point, measure that with a ruler and repeat on the other side. Then you're going to do this again, shoeless and shoed, to determine whether the problem is coming from wearing your shoes too tight or if you have an actual lack of dorsiflexion motion. If you do find that you have an actual lack of dorsiflexion motion on one foot or both and they feel very tight, then here are 2 exercises you can go over that will help with this. The first exercise we'll go over is a soleus raise. What you're going to want to do is find a step or a stool and put your toes up on it with your heels off. Next, you're going to want to stabilize yourself by holding onto something and put a slight bend in your knees. From here, lower your heels as far down as they will go, and then raise back up as high as you can on your toes, keeping the bend in your knees. Repeat this for 3 sets of 15 on each side, and you should feel that tightness in the bottom of your calf each time you do this rep at the bottom. The next exercise is a toe raise against the wall. What you want to do for this one is put your butt against the wall with your back off and your knees straight, and then raise your toes up off the ground. The further your feet are away from the wall, the harder this will be. Last thing, 3 sets of 15 on each side. Do it at the same time. With that said, thank you for watching. Don't forget to like and subscribe for more content like this. My name again is Connor Gainzer. I'm a doctor of physical therapy. Signing off.